Hello all. Here I am welcoming you on our YouTube channel Swaminarayan Physiotherapy College Rani. Myself Dr. Jeemeesha Panchal, and here I will give you information about patellar fracture, of its cause, classification of fracture and how it diagnoses. In the later part, we'll discuss about the rehabilitation. But before I start, I request you all kindly subscribe our channel for more updates. So here is the structure of the patella. It is flat, rounded, triangular sesamoid bone, and it's also known as kneecap. It play important role in the biomechanics of the knee joint. Now we'll see how the injury occurs. In direct trauma, due to direct fall over the patella, it will definitely break the patella. In indirect trauma, sudden forceful contraction of the quadriceps muscle, it occurs most commonly in the sports player between age group of 20 to 50 years. So what we can see in the evaluation. First, we will evaluate that patient have pain and swelling over the fracture area. Because of that swelling and pain, patient will not able to do any movements. Through the examination, we can palpate the gap on the front of the knee joint, then tenderness and also the signs of effusion. So there are 7 type of patellar fracture. As you can see in the given figure, the first one is undisplaced, that means hairline break on the patella. The most common one is transverse fracture as the result of forceful muscle contraction of the quadriceps. Then the lower and upper pole fracture, comminuted undisplaced and comminuted displaced fracture. It occurs due to direct trauma. And the last two one is vertical and osteochondral fracture. So we can investigate the fracture through X-ray, CT scan, MRI and bone scan. But mostly fractures are seen in the X-ray easily. So here is the plate, the lateral view and the skyline view. So here is the treatment plan. It will divide it into non-operative and operative. In non-operative treatment, suppose in non-displaced fracture, the cylinder cast apply from the groin region to just above the malleoli for almost 4 to 6 weeks. At that time, we have to explain the patient crutch walking. Then afterwards, the rehabilitation part. In the operative treatment plan, to join the patella, tension band wiring will be used. For transverse fractures, open reduction and internal fixation can be done. The last treatment choice will be patellectomy. When repair is not possible, then entire patellar is excised. It mostly occurs in multi-fragment fracture of the patella. Then after POP cast for 6 weeks, then rehabilitation part. Guys, we will see the rehabilitation part in the next YouTube video. So stay tuned. Thank you.